Welcome to the New Stewards podcast, where we speak to believers all around the world, find out what they are doing to combat the changing climate, and how their faith drives them in their work. My name is Ilyas, and I'm on a mission to ensure Muslims become global leaders in addressing climate change. I believe we were put on this planet as stewards and trustees, or in Arabic, khalifas. In this podcast series, I hope to discover what it means to be steward on Earth so we inspire and enable millions of Muslim sustainability leaders. Today, my guest is Dr. Hina Shahid. She's a general practitioner with a background in public health and a focus on family medicine for the NHS in the United Kingdom. She is also active as a humanitarian doctor, delivering primary care to the most vulnerable. Over the past few years, she has been in Greece, Calais, Bangladesh, and Palestine. She is also active as a clinical tutor at the Imperial College in London. On top of that, Hina has been the chair of the Muslim Doctors Association since 2016. Assalamu alaikum, Hina. Great to have you on the podcast today.
Walaikum assalam, Ilyas. Thank you so much for having me on.
Great. So I came across you and your profile during the Green Week from the Muslim Charities Forum. And I was quite surprised to see an actual medical doctor in there. And I was wondering, why do you, as a doctor, care about climate change?
Yeah, thanks for that question. And I think it's there are lots of different ways of looking at this, and perhaps it's one area that isn't fully appreciated between this really intrinsic link between the climate or planetary health and personal health as well. So, as you mentioned in your introduction, I have a background in public health. So when I was doing my master's in public health, that's when I really began to appreciate this close link between the climate and our own health. It was, and during that period, when I was at the London School of Hygiene and Tropical Medicine, I got involved in the divestment campaign on campus to get the college to divest from the fossil fuel industry. And if you know LSHTM, it's one of the biggest public health schools in the world, and it didn't make sense that on the one hand we had all this focus on, you know, planetary health and raising awareness of climate change as being one of the biggest global health emergencies in our time, and yet at the same time, there were funds that were being received from various fossil fuel companies or companies that had, were in some way involved in in the fossil fuel industry and other industries that were affecting the climate in a harmful way. So I got involved in that. And it really began from there. And we need to understand, as I said already, that climate change is the biggest global health and security risk of our time, and we need to act now. And it's really important to for healthcare professionals to understand this really close link and to understand our role and our power in actually doing something about it, because we are trusted professionals in society. But also, we are already seeing the impact of climate change in the work that we're doing, both in the UK and abroad. You mentioned that I've done humanitarian work abroad, in the context of specifically refugees. And we know that climate change is going to create mass displacement, conflict, with lots of refugees, famine, all of these things. And we're already beginning to see some of that. If you remember the East African famine and those really awful pictures of people who were experiencing malnutrition, this is happening on our doorstep already. So we can see those harmful health impacts of climate change. And it's really important for us as healthcare professionals to do something about it.
Yeah, I can imagine. Is it different within the scope for you as a healthcare professional, both in the UK and abroad? Does the link become more apparent when you're abroad, and how does it become more apparent?
Yes and no. So, I mean, when we talk about displacement and conflict and famine, drought, wildfires, those are extreme weather events that we don't particularly see in the UK that much. However, we have been seeing more floods in the UK, which we know is linked closely with climate change. And there have been in the last few years a number of emergency responses going out to healthcare professionals to assist in some of these efforts with
Mm.
flood. So we are seeing that on our doorstep. We're seeing extreme heat conditions. So I remember working in accident emergency and in hospitals, during the summer where, again, it's the most vulnerable people, the elderly, in particular, those who have may have dementia, those with mental health problems, those with already who have underlying chronic health conditions that are most susceptible to these adverse weather events as a result of climate change. They're more likely to be admitted into hospital and to experience complications, to die. So we are also seeing that in the UK. So it's not just something that's, a distant a reality. It's very much happening on our doorsteps.
Hmm. Wow. All right. So it's something that perhaps all healthcare professionals should be more aware of.
Mm.
Is there a general awareness within your line of work between you and your colleagues on the topic?
Well, I think there's a lot of work to be done, but it is already beginning. So, in the NHS, there's a green plan that's been created to support, kind of to create this national level framework for action on climate change and sustainability. And the aims, I'll just read them out, state that every NHS organisation has an essential role to play in meeting this ambition, and it outlines a 3-year strategy towards net zero. And um, there are some case studies and good work in particular that's happening in primary care, and some practical steps for colleagues that are working in primary care, like myself, what we can do immediately tomorrow when we go into our practice, to work towards this net zero ambition, and to play our part in preventing climate change, the climate crisis.
All right. Yeah. Thank you. Well, that's a great concrete appeal. So I would encourage people to look up that information right now. Um, then perhaps for you as a Muslim doctor, um, uh, according to what I know, a lot of the more vulnerable countries that are will be hit and are hit are in many cases Muslim majority countries like Bangladesh, where you've been. Um, what does that do to you? How do you experience seeing these events? Perhaps be going over there or seeing the news here. How does that make you feel?
It makes you feel angry because when you look at the statistics, I'm sure you know that the people who are most vulnerable and at risk of the effects of climate change are actually those who are not contributing to the crisis. So you know that the Western countries of the global North are the biggest producers of fossil fuel emissions, have much larger carbon footprints. Um, but it's the countries in the global South who are most likely to be impacted, whose health is harmed first. They have lesser resilience healthcare systems, and in addition to all the other infrastructure that goes with building climate resilient cities and towns and villages. They just don't have those resources, but they're not the
Mm.
ones who are producing it. So there is a sense of injustice that that you do feel, anyone would feel. And I do quite a lot of work around health inequalities, and what we're seeing here is that climate change has the potential to actually increase health inequalities and further the divide between the global north and the global south. And over the last 50 years or so, there has been a lot of progress that's been made in some of these countries, in particular with Bangladesh. But if we look at Bangladesh as an example, it's a low-lying country. It's very, very vulnerable to flooding, um, and populations can be wiped out. But they're not the biggest producers and contributors to climate change and global warming. So it means that in the living in the West, in the global North, we do have a role to play in being advocates in and really pushing towards really reducing the impact of our activities and the impact that they have on climate change. So there's a lot of work that does need to be done.
Yeah. What does that? What does that? How would you reflect on your Hippocratic oath within that context? Perhaps also in the sense that we know that there is quite some. Here in the Netherlands, we know that our emissions of the healthcare sector are 7%. I looked it up for the UK; it's about 4 or 5%. So there's a lot of emissions that are emitted or as a result of healthcare within Western countries. How can we resolve that perhaps conflict between on the one hand the oath and and the do no harm principle in there, and on the other hand, uh, the indirect effects that we're seeing.
Mm. So, the principle of do no harm actually applies very well to climate action. Um, because when we think about do no harm, often we're just focused on kind of, individual personal health, right? But this is about planetary health. So I would say it's part of our role as healthcare professionals, but also, you mentioned khalifas as well, and as our role as Muslim healthcare professionals to make sure that we do support planetary health as well as individual health that we do in our day to day job. Um,
Mm.
so the two are really closely linked. I don't actually see a conflict. I see a complementarity between the two.
Hmm. That's wonderful. How could you perhaps explain planetary health for those of us who are not familiar with the term, and how it is linked to personal health?
Yeah, of course. I mean, in a very, very simple way, it's the health of our planet. And there's this concept of kind of one health that looks at how we're all part of this one ecosystem, whether it's us as individuals and the rest of creation. And again, it's very much linked to Islamic principles. We are here to serve our creator, and we do that in part through serving creation. And creation is includes other human beings, but also includes animals, plants, the natural environment, and everything around it. So it's just one big ecosystem, and we're very interdependent on all different parts of this ecosystem. So the actions that we take to can support our health or harm our health, but can also support and harm the health of the planet. And there are lots of interesting ways of looking at this actually, and how the positive actions that we take, um so in particular, for example, around the food that we eat, how the physical activity that we do, how we connect to the outdoors, how we connect to other people, can actually have a positive impact, not just on our own individual health, but also on the health of the planet.
Hmm. Yeah. An apple a day keeps the doctor away, and I guess in a climate sense, that's a very good thing, right? To focus on your in the first place on your own health, and focusing on prevention to make sure that the healthcare process, which right now is part of well, of an industry that emits a lot, is a way for that to be prevented. So there's something in there for perhaps both doctors to make sure the care you are providing is more planetary friendly or planet proof. But for patients as well, and I hope not patients primarily, to take care of their own health
Mm.
as part of yeah. Well, that is a beautiful concept because it makes it really concrete, right, for each and every one of us in our daily lives
Yeah.
to see that as a
Yeah, and also it's linked to our role as Muslims. And so let's take the example, just to bring some of this to light and to kind of look at some practical things. If we look at nutrition and diet, right? Diet impacts both personal and planetary health. So we know in the West, for example, and if we remember that we are the biggest producers or contributors um to the climate crisis, then we know that the majority of conditions that we're seeing in the West are due to are what we call non-communicable diseases or chronic diseases, and in the majority are caused by poor diets and overconsumption, right? And that's contributing heavily to the burden of disease, and this is also contributing to planetary harm because we're producing wasted resources, pollution, the demands of a lot of energy that's required to produce these foods and to maintain animals for food as well. So we can really see the harmful impacts of some of our dietary choices. So, what kind of things can we do? And also, how does this link with, for example, the current cost of living crisis? I mean, you can see that there are so many co-benefits in different realms. So, in the Muslim community, for example, there's this culture to eat a lot of meat, right? But if we look at the practice of the Prophet ﷺ, meat was a rare treat, and you know And we need to go back to those basic principles and practices. So, how can we lessen our meat consumption, which we know is harmful for the environment, which we know actually is not really in keeping with what we should be doing as Muslims, but also is harmful for your health. Red meat consumption is linked to cancer, it's linked to cardiovascular disease. Um, so, you know, switching to more vegetarian or plant based diets is good, it's better for your health, it's better for the environment as well. Um, Going for options that are locally grown so that you're reducing those transport costs and, reducing the carbon footprint, avoiding waste by looking at your portion sizes, meal planning, eating leftovers for the next day rather than going out and having takeaway.
Mm.
All of these things are helping our health, the planet's health, and helping our wallet as well in a time where actually people are really feeling the pinch because the cost of living has gone up so much in the UK, but I know it's similar across other European countries as well.
Yeah. No, definitely. And I like how you're linking real world challenges in the West, healthcare, and our own health as well. And I think that's a really nice way of approaching it. Perhaps the only element I would add, and it's not really up to me to add something, but make that a ibadah,
Mm.
make that an act of worship, make your really concrete, active gardening, perhaps, or buying locally, make it an act of worship. I think that then, you've really hit a lot of wins in there. Your own health, your relationship with Allah, uh, and the health of the planet.
Mm. Yeah, absolutely. I mean, that's a beautiful thought. Um, and also if we look at, what it says in the Quran, for example, around eating food, eating that which is good for you, there's a concept of tayyib, and we often forget that. So what does that look like? What does that actually mean? It's food that's nourishing. It's food that's ethical. It's
Mm,
grown in an ethical way. Remembering about the, uh, you know, keeping 1/3 of our stomach for food, so preventing this overconsumption, because actually, if we look at the crux of the issue around why we're seeing the issues with climate change is because of overconsumption and greed, right? That if you strip it back down, that's what it's down to. So, you know, being conscious about our choices and being minimalist and really having an ethical outlook into all the lifestyle choices that we make are very closely linked to our own individual health, that's our health kind of, and I mean health in a holistic way, right? I include our physical health, our mental health, our spiritual health, but also the planet's health. So, it's again going back to this whole concept of one health. It's all
mhm.
closely interdependent. We're all part of one big ecosystem.
Yeah. Now, for you, when you're seeing patients, is this something you're discussing to really discuss lifestyle, perhaps, and their how choices affect our health and the planet's health as well? Is this something that makes its way into the what's the word I'm looking for? Into the doctor's office. There we go.
Mm, yeah. I mean, I have a real interest in lifestyle medicine and how we can use more lifestyle approaches to promoting health and preventing illness. I think there's a real role for illness prevention through optimizing our lifestyle. So yes, I frequently have conversations with patients around, what lifestyle choices they could be making. We've discussed nutrition, but physical activity is another big one. And again, physical activity is when when patients say to me, well, it's we have busy lives and we can't really um, have chunks of exercise. Well, I say it doesn't have to be
Mm,
chunks of exercise that you set out in the day. Just bring it into your work, into your day in small amounts. So it may be, um, for example, I'll use myself as an example. So for me, I have a choice whether I want to drive into work or whether I take public transport with a bit of walking into work, right? It takes me the same amount of time. It's much easier on those cold or wet, windy days to get in the car and drive in, right? But I know that if I'm going on using public transport, I have a lower carbon footprint. I'm also able to get my walk, my get some fresh air, right, which makes a huge difference to your sense of well being, and I get some physical activity in. and I choose to do kind of home visits as a family doctor. We do visit patients at home. So I choose to do my home visits on foot rather
mm,
than driving. So I'm able to bring in, on a practical level, physical activity with the co-benefits of, of reducing my carbon footprint in the environment and doing my bits on a day-to-day basis, to support the health of the planet. So
mm,
similarly, everyone can do that, patients, or even, hopefully you don't become a patient, because you are focusing on prevention, by bringing in the small changes and just looking at the multiple benefits, that those seemingly small choices make, but actually they can be really powerful if all of us started doing that on a daily
mm.
basis and bringing those small changes in our daily life.
Yeah. Well, another nice concrete tip as well. Is it more difficult to have those lifestyle conversations with younger people rather than perhaps your slightly older patients? And do you have any tips regarding lifestyle change conversations we would like to have with our parents or our grandparents who are perhaps a little bit more stuck within their ways or really used to a certain type of lifestyle?
Mm. Yeah, you're right in the sense that, it's I think it's easier to have this conversation with younger people. Um, well, it can be a mixed bag actually. So in some ways, it may seem that it's easier to have this conversation with the younger people because, they are more flexible in their ways, and therefore, you may think that they are more likely to build in new habits, right? Versus somebody who's a bit older, who has established, their habits and routines, and you may think is it's more difficult for them to change. But that's not necessarily true, because what I'm seeing, for
Mm,
example, is people who are in their 40s, who are now kind of in that middle age period, and thinking, okay, I need to do something now because, I'm getting older and I need to look after myself and my body. So I'm seeing a lot of people, in particular in the middle ages, taking up fitness, in a way that hasn't been seen before, and really being conscious about the food that they're eating, the exercise that they're doing, their sleep, which is really important, looking at how they're supporting their mental health and well-being, looking how they're managing their stress. So people are being really proactive about that. And if we go further along the age spectrum, um, you know, it can again, it may be tricky in people who have established a set pattern, but it's not impossible. I mean, I have an interest
mm,
in elderly care, and so, I speak to elderly patients all the time, about some of the choices that they're making. And now, actually, if we link it to the cost of living crisis, people are really thinking about, how they can spend less on food, um,
mm,
or look for cheaper options. But cheaper options don't have to be unhealthy options. It could be things like going to a local farmers market, or supporting locally grown food, which is cheaper. So people are being more proactive about that. But I think we need to have those conversations across all ages. So I wouldn't say just because somebody's older, don't have that conversation. Absolutely have that conversation, and
mm.
you'll be surprised.
Yeah. All right. Thank you. Um, I'd like to shift perhaps towards the Muslim Doctors Association for a second. Like we just discussed, there is a real urgency for each and every one of us to become more active in preventing climate change and addressing this issue. You could say that as a Muslim, as a Khalifa on earth, there is an even higher responsibility. The responsibility is the same for everyone, but the appeal is different, perhaps. How does that translate maybe in the way you work and the way you communicate with your members or the people you represent from the association? And is
Mm,
there something you would like to change or put more emphasis on over the coming years?
yeah, I think it's something that, um, we'd like to do more in terms of raising awareness, around these co-benefits that we've discussed, and and encouraging Muslim doctors to be active in looking at how they could be contributing to reducing the, um, climate impact of their activities at work. So it's something that we would like to do more work on. We haven't I haven't we haven't done as much as I would like to. We've done a few campaigns that you mentioned with the Muslim Charities Forum, but it's certainly something that we would like to do a lot more of. So watch this space and see what comes up.
Yeah. And anything concrete you could share, or perhaps um, advice you would have for Muslim doctors listening right now, where they could start within either their own practice or their own profession?
Yeah, sure. So, I said everybody can do something at work, or even in their personal life. We've gone through a few of the personal things that people could do when it comes to, those lifestyle changes. But if we shift the focus more to our workspaces and our work environments. So I earlier refers to kind of the NHS Green Plan. So I would really encourage, um, Muslim doctors who may not have come across this to, to look at the Green Plan. The other thing to say is, although that our name is Muslim Doctor Association and Allied Healthcare Professionals, so it's not just doctors, but it's,
Mm.
it's healthcare professionals that work, in the health sector. So it could, nurses, dentists, dietitians, pharmacists, psychologists, etc. Because the NHS is a place where there are lots of diverse professions, but we can all do our bit. So there are some really good case studies on there, and I've really, and in particular, some case studies that have come from general practice, which I really resonate with.
Mm.
So the simple things that people can do at work. They've given examples like replacing plastic cups with reusable glass cups. I mean, I've got a cup that I take in every day to work. It's reusable. I don't have to do, I don't use plastic cups. Collecting used batteries and ink cartridges, making sure that they are then sent off to a recycling company in aid of a charity of their choice. Turning off electronics. This is a big thing. I absolutely hate it when I come into work and I see the computers all been left on. Well, I mean, thankfully we have these lights that are automatic and kind of are able to sense when somebody's around, so they switch off. But I really hate it when I come in and the computer's been switched on, from the day before or last few days. So making sure that you're turning off your electronics at work. Um, and then there's this think before we print initiative that's also covered in this plan. And actually, that's something that we're quite big on in the practice that I work at. I hardly ever, so if I'm writing letters for patients, I hardly ever print them out. I will send them as an
Mm.
electronic copy. There's a link that we just send it off to patients so they can open it on their phone. Everything's electronic anyways now. People are not really using post much. So if they need a letter for work, for example, they can just email that letter across. We don't need to print. We don't need to print hundreds and thousands of letters to patients reminding them about um, whether they've got a test coming up or they're due for various screening. It's, we do it all electronically. So again, all those simple things are reducing our carbon footprint and contributing towards a more greener NHS. So there are lots of things that people can do, but I would encourage healthcare professionals, Muslim healthcare professionals, to really um, take a bit of time to look at their work environment and
Mm.
see, what are some of the issues here or what are some of the things that we're doing that could be harming the planet, and how could we do this differently? And what are the simple things that we can do? I mean, the things that I've listed are so easy. It doesn't require you to do much at all, and it's really easy to implement as well.
Yeah. No, definitely, definitely. I agree. I work as a in a hospital myself, and it is the easiest step to start, and then perhaps you get in some slightly more complex issues, such as using more reusable materials.
I know.
But the ones you've listed are, I hope, very easy for people to do. So I would like to see that happen, perhaps, and for Muslim doctors to take pride in that as well. I apologize for the pun, but prevention is the best cure, right? Especially in a climate context. And I have the feeling, and perhaps you can resonate with this, that as Muslims, we're very much focused on donating, helping, being there as Muslims once we reach well, after the catastrophe has happened. And unfortunately, in these times, many of the catastrophes we see are climate catastrophes. Is there a culture shift we should be making, perhaps, towards? Well, I mean, I'm not advocating against donating in case of catastrophes, but is there a culture shift um, we should be making towards more prevention in case of climate change, and perhaps setting up infrastructure for that as well?
100% yes. You have, you picked on a really important point. So in the UK, for example, we as the Muslim community, time and time again, kind of top the charts of being the most generous community. And alhamdulillah, it's something that we should be really proud of. And it's, um, to have that accolade that we are the most generous community in the UK. Um, but I think we need to be smarter about the way that we donate. To really have a more long-term preventative lens, um, and approach to our donations. So what we're doing, by way of analogy, is we're basically kind of rushing to put a plaster on a bleeding wound, when actually we should be looking at kind of treating the underlying injury and what can we do to, for that long-term healing to take
Mm,
place. Um, so I'm sure, like many other Muslims, and like yourself, in Ramadan, I sit down and think about, okay, where am I going to give my donations this year? Um, and so I'm not the type of person that will just give it to one charity or, the same cause. I mean, there are certain causes that I do feel um, really close to, and so I will donate to those. But but I will donate to those and other causes when I actually kind of do an activity, an analysis in my head about, well, you know, what is the sustainability of this project that I'm donating to? Um, how is it going to help communities, people and communities in the long term, and how is it going to positively impact the planet in the long term? So, we need to. It's really easy to kind of donate, and I'm not by any means saying that we shouldn't be donating to immediate relief causes, because they have a role to play, and we have a role to play in supporting those initiatives. Where, if there's been a humanitarian catastrophe, then absolutely yes, we must donate and support that, but that shouldn't be the only way that we give our money. So, I'm thinking, for example, with some of the projects that I support is mainly around kind of livelihood and empowerment projects, or health projects that where you're building capacity in local systems. Um, so it's about increasing capability, increasing capacity in local communities, so that they don't depend on foreign aid and foreign expertise. And if you create the capacity in local communities, that inevitably is going to be a positive action for the climate, right? It's just intrinsically linked.
mm,
Um, there are a lot of kind of agricultural projects as well, good for the planet, planting trees, all of these things. There are a lot of projects that we could be supporting that actually support planetary health and support sustainability of local communities. Last year I went traveling, and had the opportunity to actually go to Peru and visit the Amazon rainforest. And from the window, you can just see areas of deforestation of of the Amazon forest. And this was a dream of mine to go, since I studied about it in school, right? Um, and when and they told us about the Amazon being the lungs of the planet. And I was thinking, wow, the lungs of the planet are being destroyed. And they're being destroyed because we are being greedy. We're being greedy for food, we're being greedy for material resources. Um, how it's again linked to our the way that we consume. And I know you asked about philanthropy and donating and about giving, but also what are we taking? And we need to be
mm,
thinking about, what are we taking, what are we consuming, where do our clothes come from, how are they made, what is the material, how is it fast fashion? And we've all been there, we're all guilty. I'm guilty as well of consuming fast fashion. But it's when I became aware of the impact that every single decision that I take, from what I wear to what I eat to how I travel, when I started thinking, what impact is this having on the planet? And that's when that awareness can then lead to positive action. So, the take home message, I guess, from this would be just, be aware and be conscious of every single choice that you make, whether it's giving or whether it's taking and receiving.
Well, I like how you took it from donating to uh, our general spending habits, perhaps, and because donating are a couple of percents or tens of percents, but then our spending habits is the rest of that. So, if I'm understanding you correctly, it's to look at the perhaps the whole chain of your impact, right? Before your purchase and what happened there, and then perhaps also what happens after you buy something or dispose of something you bought, to really be aware of the supply chain of your behavior. Yeah. It must have been horrible to see the rainforest like cut down for pleasure purposes in many cases.
Yeah, yeah, absolutely. I mean, it's just, it's beyond words because it kind of it brings to life the greed, you know, um, and the terrible impact that it has on. And if we think about the rainforest, it's not just trees, it's animals, it's birds, it's insects, it's the whole, it's indigenous tribes and communities. Again, coming back to what we talked about earlier about those most vulnerable communities being at risk, and what have they done to actually contribute to
Hmm.
the climate change, right? But here they are, their homes are being destroyed, and species are becoming extinct because because of our choices. But also, just coming back to the philanthropy and charity work, I think there is a lot more that charities could be doing to think about how their initiatives are more green and sustainable. I mean, I know I talk about sustainability from a kind of livelihood and empowerment perspective, but also from a more material perspective, if like how many leaflets do we get in the post from charities about donations?
Hmm.
They need to be thinking about why are they spending all this money on printing paper and contributing to increasing the carbon footprint when we have emails, we have text messages, we have electronic resources. So the charity sector could be doing more around looking at their carbon footprint, and then even when we are supporting humanitarian projects, like the material that they're using. How is it just recyclable plastic, one use, donation that they're making, that they're giving to these communities? Or, it's thinking about materials, it's thinking about the wider kind of philosophy um of their projects. So I think there's a lot of scope for the Muslim charity sector, which is huge in the UK,
Hmm.
to
Hmm.
be thinking about their environmental impact. And I would say every Muslim charity really should be carrying out an environmental impact assessment of their activities. I think that could be an actionable step for them to take. Is looking at how their activities are contributing to climate change. Because I think, again, if we look at co-benefits, and you asked me about the Hippocratic Oath, and I said, well, actually, there's complementarity. I think there's a bit of hypocrisy if you are, on the one hand, working in the humanitarian and aid and development sector, and on the other hand, engaged in practices that are harmful for the environment. It's like you're feeding into a vicious cycle. You should be,
Hmm.
as a Muslim charity, Muslim organization, you should be looking at breaking that cycle.
Yep, I'm very biased, but I couldn't agree more. Um, I think I've just finished reading a book on environmental conservation from an Islamic perspective, and it really brings forward the concept of ihsan
Mm.
towards all these different aspects of creation, towards ourselves, other human beings, animals, inanimate objects as well, the soil, earth, air, water, and that I did not expect it to be that ihsan to be that broad. But if you really and perhaps that's well, that's exactly what you're saying as well, to be really conscious of every action you take and to aim for the highest purpose and the most contributing in the most positive way. So that's a really beautiful message. Thank you so much.
No,
Is
thank
there a
you. I mean, that book sounds amazing, and just, it links to that concept earlier of One Health. If we're bringing it back to health,
Hmm.
it's the health of everything is linked to each other, and you're absolutely right. We don't think about the inanimate objects, the soil and the air, the water, which are again part of the whole ecosystem, right?
I'd like to add something to that, and that is that I think that as Muslims, and that's also what you're saying as a from the One Health perspective, Muslims should be champions in system thinking, in really thinking in systems in everything we do, because I think that will make us a lot stronger financially, like from a health perspective, economics and finance is the same thing. But it will really make us a lot stronger if you really consider the entire system you're affecting and that you're a part of in everything you do. And
Yeah.
that's, I think, something that you're advocating for, to look at yourself and your surroundings from a One Health perspective. And that's then a health scope. There are so many scopes that we could be system thinking within.
Yeah,
Yeah.
absolutely, absolutely. And that's when you asked earlier about what can Muslim doctors and healthcare professionals do around being green champions. Well, it's this is a clear example. What they could be doing is having that system thinking approach. Themselves, their environment, the wider NHS organization, their community, their family. There are all these different spheres that we can influence. And it's thinking about, what are those spheres, and what positive influence can we have? And sometimes it's a
Mhm.
conversation. It starts with a conversation, and you don't know where it may take you.
No, exactly. Exactly. Especially if you take in mind what you said in the beginning, where healthcare professionals are one of the most trusted uh, uh, parts of society. We trust our doctors and nurses. We trust them to do what is good for us. And I think there is room for more opportunities for doctors in general to become more vocal climate advocates.
Mm.
Um, Especially now that we've learned today that the health implications can be so severe if we don't address it.
Yeah, absolutely. And if we don't address it, it's only it's only going to get worse. I mean, there's some statistics around, for example, between 2030 to 2050, climate change is expected to cause approximately 250,000 additional deaths per year,
Whoa.
from malnutrition, malaria, diarrhea, heat stress, all of these that are, that are linked with climate change. And the direct damage, costs to health is estimated to be between $2 to $4 billion per year by 2030. So the costs are
Subhanallah.
huge,
Yeah.
um, you know, to the planet, to the economy, people's health and livelihoods. I don't think people fully appreciate, how big an issue this is, and that's why we need more
Mm.
work to be done in advocating this. And there's work that all of us can do. I mean, I think about my choices and some of the things that I could be doing better and differently. So it's constant work in progress. It doesn't stop.
No. Yeah. No, that's beautiful. I agree. It is a continuous process of improvement. Taking some steps every day. I think that is a beautiful message to end our conversation on for today. Thank you so much for your time and the amazing conversation today. Assalamu alaikum.
Wa alaikum salam. Thank you so much for having me.